my main reason for wanting to say something about it is not so much that I'm a passionate defender of the single-payer system, but that the bad publicity the British system gets is really not justified in most respects. The other thing that Americans really need to know about the British system is this is a government-run system that costs, wait for it, half or less than half per capita what the American system costs. This is almost unique. It's very hard to find another government system which is cheaper than the private enterprise alternative. And of course the reason is that the American system is not really competitive. It's not really a free enterprise system. In some respects, the Britain's NHS is more competitive and more free enterprise than the American system.
Now, someone hearing you say that's going to say, wait a minute, the government runs it. How can it be more competitive? How is it more competitive?
Well, the reason is that they spend a lot of time worrying about incentives, how medical staff should be reimbursed, how they should be evaluated, and so on. Now, it's way far from perfect. I won't say it's an ideal system, but they do, in fact, worry a great deal more, I think, about the incentives available to doctors and nurses and other healthcare people than the American system does. The other reason, I think, for its relatively low expense is that there's almost no paperwork. In other words, you go into an English NHS clinic, they don't ask what your insurance is. They don't have a raft of people tapping away on keyboards. For a practice of, let's say, 5 doctors, which is what I'm familiar with, as far as I can see, there are precisely 2 administrative people. There are 2 people and a couple of nurses. And that, of course, is a huge saving.